Okay, team listen up. We got a new mission. 18-year-old John, MVA, blown force trauma to the abdomen. He had CT scan showed left frontal temporal contusions, right subdural hematoma, community fracture to the petrous temporal bone, ruptured spleen, and decompressive craniotomy, cranioplasty, and removed spleen. He was in ICU for 12 days and was for 51 days, and he was in rehabilitation for 9 weeks. So now let's get John back into the road to recovery. So what do you suggest?
Everybody stop! It's not about us, it's about our patient John. Our mission as the Health Avengers is
ensure that John's current medical conditions are being managed efficaciously, restore John's functional skills, help John to manage his mental health, and reduce John's risk of developing any chronic conditions.
Let's do this!
Let's do it! Health Avengers!
Hi John and John's carer. I'm sure you remember me, but I'm a pharmacist. I just thought I'd sit you down here today just to talk about your medications. Okay, so we'll be monitoring your INR in order to get you up to the target range and in order for the doctor to titrate your warfarin doses appropriately. How's your PTSD going? Yeah, we'll be gradually decreasing your paroxetine dose in order to eventually take you off the paroxetine, and the doctor has actually referred you to start counselling, weekly counselling sessions, as well as cognitive behavioural therapy. So we will be taking you off the meloxicam and putting you on just normal Panadol, paracetamol for your pain. And I will make up a Webster pack for you and deliver that to you weekly. Thank you very much. Thank you, John.
John,
Hi.
how are you?
I'm good, thank you.
That's great to hear. So the main change is this Webster pack here, which gives you nice labels for all your medications, so you never get confused about what medications you have and haven't taken when you're at home. How does that sound?
Yeah,
So I'm the physiotherapist, and as we've discussed, the second priority for John is to work on his functional mobility, which we require balance for that and mobility with dual tasking. So we decided on working on mobility on an uneven surface. So we went to the grass and we used the ball and standing on one leg to challenge John and make it more of his interest of soccer. So, as you can see, John is walking down the stairs with a step 2 without using the rail because he's still dependent on the stairs.
Hi Physio, I'm Exercise Physiology. I'll take over for John from now on. See you later. Okay, I'm going to change up the stairs exercise so that it becomes more aerobically stressing for John's heart. This is in order to achieve priority 4 in our management plan, which is to reduce John's risk of developing things like cardiovascular disease, something that's quite common for people who have had traumatic brain injury. Okay, here we've got John doing some hopping, jumping, and throwing the ball at the wall. We're doing this because it uses the lower leg muscles, and that will elicit a greater cardiovascular and heart rate response, and hopefully help to increase his VO2 max.
Hi AP, how are you going? How's John's exercise going?
Yeah, it's going really great. He's really enjoying the soccer ball program, and just being able to do some exercise with aerobic exercise and resistance to work on his strength. He's just really loving it.
That's great. What can I do for you today?
Yeah, I'm just a little bit concerned about John. He's having a bit of nausea and dizziness as he's doing his exercise. I was wondering if there's any changes to his medication that might induce that.
Yeah, there have been some medication changes. So we're actually been gradually decreasing his antidepressant dose, which we're using to treat his PTSD, just so we can eventually take him off it. So we've been slowly decreasing the dose, which I think can actually cause some withdrawal symptoms, such as nausea, dizziness, and just feeling a bit off. But not to worry, these symptoms are only temporary and they should resolve once his body gets used to not having the drug in his system.
Great, that's good to know. Yeah, I'll just make sure I keep an eye on those symptoms and make sure they don't get any worse.
Team meeting time, guys.
We've done a great job with John so far, and we've had lots of different people from a multidisciplinary level come in to help us. John's lost an amazing amount of weight with the nutritionist doing his diet. He has been seen by a speech path and he's doing really well. He's singing some songs, he's you know, enjoying being more social and going out with friends. And he's also had lots of meetings with his sister, had some counselling sessions with the social worker, has been involved, and now his sister and him have a great relationship. So what have all you guys been doing?
Okay, so I've just been working on John's medication and
What does John think about this?
So past 4 weeks has been great. Thanks, Health Avengers. You really saved my life.
Our pleasure, John.
In our world, we put you first! Health Avengers!